Okay, fine. Today we are starting a new topic, diagnosis and treatment planning. This diagnosis and treatment planning. So, diagnosis and treatment planning. This term is you people encounter this term day to day, and that is usually in every department. Every department you will start with diagnosis and treatment planning and cases. Why there is a need of going through this in each department. That means why there is a different why there is why you have to learn about diagnosis and treatment planning and case histories in every department. So when you are just a second. Every time there is some difference in diagnosis and treatment planning in department to department, or as you go in radio, you will be more concerned about the gingival problems or the periodontia. When you go to prosto, you will be more concerned with the hard tissues than the soft tissues. Likewise, in orthodontics, you will be more concerned about malocclusions and the skeletal patterns. So, what is in diagnosis? Diagnosis is a Greek word. It meaning to discern amount to the difference between. That means to know the difference between something. That means diagnosis is determination of presence or absence of the abnormal undesired. That means diagnosis is thinking about or extracting the problem, the underlying problem. Orthodontic diagnosis, it deals with recognition of various characters. It concerns with recognition of various characters of the malocclusion, involves collection of the patient data in the systematic manner. That means by the case history, we'll gather the data and again analyzing these data will reach towards a final diagnosis. Orthodontic diagnosis needs a sound scientific knowledge, a nice clinical experience, and obviously common sense. By having these all three, scientific knowledge, clinical experience, and common sense, will be uh, able to reach the final diagnosis. So, what is a diagnosis? Diagnosis is in data. It's in data we'll collect from the patient by asking some questions. Patient will give some answers. Then again, you will observe and there will be some analysis or some diagnostic aids used. That means X-rays, photographs. Combining all three, you will uh, create your diagnosis. In orthodontic diagnosis, there are two types of uh, diagnostic aids, essential and supplemental. Essential diagnostic aids are case history, clinical examinations, study cast, radiographs, facial photographs, and lateral cephalography. Supplemental diagnostic aids, it is specialized radiographs, electromyograms, diagnostic setup. So we'll see this in detail further. This is a question of SAQ. Enumerate essential diagnostic aids or enumerate essential or enumerate diagnostic aids. So when these types of question comes for your theory exam, you will have to mention both the diagnostic aids, essential as well as supplemental. Now starting with case history. What all things we see in case history? First will be personal details, then chief complaint, medical history, dental history, prenatal history, and family history. Starting with personal details. Personal details will be starting from name of the patients. We'll ask the name. Why name is more important? There is very chewed questions in every department. Why there is a need of asking patient asking name? Because and the answer is ready with you to make a good report. In orthodontics, as your patient is there with you for the whole year, or you can say for 2 years. So when we call a person by his name, so person feels that there is some that means this clinician or this doctor has some nice interest in my treatment because he remembers my name. So this is why the name is important. Then age. Why you need to ask age? Uh, According to age, you will compare the chronological eruption of chronology of tooth, or according to age, you can modify your treatment. For example, in orthodontics, if there is class 2 patient, I hope you understand what is class 2. A class 2 skeletal patient is there and he is still in growing phase. That means patient is at the age of 11 to 12. So you will think of growth modulations in that age. If the patient is beyond its growth phase, you will have to think of camouflage or surgical treatments like that. That's why age is important. Again, one more thing for age, that is aesthetic concern. If there are children or growing phase, or you can say teenagers, they are more concerned about their aesthetic appearance. That is, if you give some bulky appliances to them, they will feel shy to wear it and go out. So you'll have to take this in consideration. If the patient is adult, same thing will be there. This adult patient will be uncomfortable with bulky appliances or the appliances which can be seen from a distance. So in these cases, you will have to think about more aesthetic things to give. Am I audible? Everybody can listen.
Yes, ma'am.
Yes, ma'am.
Okay, fine. Then we'll ask, you will note down the sex of the patient, female, female. Then occupation. Why we need to ask occupation in case history? Any rough idea? Can anybody tell? Rachana, tell us. Why we should ask the occupation? Occupation of parents or the occupation of the patient?
To know the
Ma'am,
socio-economic status of the patient.
Okay. So by knowing the occupation of parents, you will be coming, you will be familiar with the socio-economic status of the parents. Like as patients parents are well to do, that means they are well enough to earn, so you can um tell the treatment plans which are more costly. Likewise, if the patient's parents or patient is not that much, patient is not having much earnings, so we'll be going for lower cost treatment. For example, if a patient comes from a rural area or the slum area, and if a orthodontist tells treatment for the patient, like you can go for aligners, you can go for lingual appliances. That means the costly appliances patient will not afford, and patient will not start the treatment. So the occupation is important for socioeconomic status. And again, if the patient's the occupation sorry if the patient is not well earning, so it will show their interest about the treatment. Like uh, if the patient needs surgical treatment, but the parents are from a rural area, अगदी खेड्यातले आहेत, so they will not allow the patient to go for surgeries. So we'll have to make them understand why this is needed. So that's why it is important to know the occupation and the address. Obviously, for the communications and know the locality, how far their locality is from your clinic or your area of clinic. Now, next, coming to chief complaint. Okay, coming to chief complaint. So, like every other case series, here we will be asking the chief complaint. What is chief complaint? Chief complaint is that what patient tells you. What complaint does the patient have? So here there is a big difference of chief complaint of a orthodontic patient from the other patients. Sometimes patient is aware of his appearance or the malocclusion. So directly the self-motivated patient will come to you and will say that my smile is not good, my appearance not good, my teeth are